Hey, I'm Dr. John Mullins. We're back here at Marshall Lifestyle Medicine, and while we're waiting for Mark to get our stem cells ready for infusion, I want to go over a few frequently asked questions that I receive. The whole topic about stem cells is one that is relatively unknown to the general public. I know people have heard the term stem cells probably in different connotations, some good, some negative, and I think the majority of people are just somewhat indifferent about the actual procedures and as to the benefits of them. First off, we're going to be injecting live stem cells that are derived from the umbilical cord of a newborn infant. We all carry stem cells within our body. Even until our dying days, we have stem cells that could potentially be used for these purposes. However, the ones that we harvest from ourselves, either in the fat or in the bone marrow, for one, they're older and they're less robust and they're less effective at trying to achieve the results that we're after here. The umbilical cord stem cells that are derived, again, from a newborn infant, no one is being, there's nothing that happens with the infant. I know there's a lot of misconceptions about that. These are things, the umbilical cord that typically would just be thrown away, for lack of a better word. And those are donated, clarified, spun down, and then subsequently sent to clinics like myself. Things that can be treated with stem cells, a lot of research is currently undergoing the wide array of possible treatment options related to stem cell therapy. The most widely recognized or the widely used one currently is using stem cells intra-articularly in either your knees, your hips, elbows, shoulders, etc. in people that have chronic degenerative arthritis or chronic other degenerative processes, in order to try to alleviate or to push back potential total joint replacement, or in some instances people are just suffering chronic pain that's resistant or recalcitrant to current therapies. The stem cells are injected locally into the spot, and they perform their duties by enlisting the damaged tissues to regenerate, form new cartilage, new connective tissue, and with the ultimate goal of trying to alleviate pain and to increase functionality of the involved joint. What we're going to be doing today is somewhat different than that. We're going to be injecting live stem cells intravenously, and there's a lot of research going currently with respect to the utility of this kind of treatment, most of which centers around people that have chronic ailments, chronic disease states that are in large part age-related, whether that be arthritic conditions, COPD, rheumatoid arthritis, chronic pain conditions that are recalcitrant to current therapies. And I think there's a great utility in that. What I'm doing, I don't have those illnesses currently, and I'm trying to alleviate that. So for purposes of today's video, I'm going to be injecting these into myself for purposes of general well-being and anti-aging, and that's kind of my goal. I like to try all the things that we're utilizing here at our clinic, and I'm going to kind of keep you posted as to my progress post-injection of the stem cells today. So again, my job and a lot of clinicians' job right now is to educate the public as to the utility of this particular treatment modality and make sure that we do an adequate job of triaging the folks that do qualify for the treatment or could potentially benefit from the treatment, and then deliver the treatment in a safe environment that is clinically based, and with the result being outcome improvement. So in a minute we'll join back again, and you'll see me live having the stem cells infused, and you'll see how easy this procedure is to perform. He's already started my IV. The stem cells will simply just be dripped through this IV in the same manner we would if we were giving IV fluids for any other purpose. So again, thanks for joining us on this live feed, and we'll be back here just shortly, and we'll talk some further about, and if somebody has a question, this would be a good time to send a live question, and I'll answer it for you. Thanks.